Hello and welcome to this Ask the Expert session. My name is Dr. Scott Turner. Today I'll be providing answers to clinical questions submitted after a recent educational program titled Moving Forward in Alzheimer's Disease, New Management Paradigms for Patients and Healthcare Systems. How has neuroinflammation developed as a therapeutic target in mild cognitive impairment and Alzheimer's disease? Neuroinflammation is a major pathologic feature of MCI and AD brain, reflected in part by gliosis in response to amyloid deposition. New discoveries in genetics have also pointed to a major role of neuroinflammation in Alzheimer's disease. The bulk of Alzheimer's treatments are really targeting amyloid and tau, but neuroinflammation is emerging as a target for several new clinical trials. For example, with a monoclonal antibody to TREM2 activating microglia to clear amyloid plaque indirectly, and this is called the INVOKE study. And there are several other inflammatory strategies in the pipeline. Which patients are good candidates for amyloid or tau PET if available? Amyloid and tau PET are primarily research tools since they're not yet covered by Medicare or third-party payers. Amyloid and tau PET are useful to determine trial eligibility and useful for diagnosis, for prognosis, and to determine efficacy of new treatments. A patient treated with an anti-amyloid drug, for example, must have documentation of elevated brain amyloid by either PET imaging or spinal fluid analysis. While anti-amyloid antibodies under development decrease amyloid burden, their clinical benefit remains controversial. Amyloid accumulates in the brain for 10 to 20 years before cognitive decline begins, and this has allowed prevention trials of cognitively normal but at-risk older individuals that will read out in coming years. Are there any limitations on when to perform a lumbar puncture in a patient with suspected MCI or AD? There are several contraindications to lumbar puncture, including patients on anticoagulants and those with a known coagulopathy, platelet deficiency, individuals with chronic low back pain, a history of lumbar back surgery. The CSF analysis of A-beta, tau, and phospho-tau are useful for diagnosis of Alzheimer's disease, and this test and the LP procedure itself are usually covered by Medicare and insurance. CSF analyses are also useful in clinical trials to demonstrate target engagement and show evidence of efficacy. How do you interpret biomarker findings when diagnosing a patient with AD? There have been recent advances in biomarkers that have led to the so-called ATN classification scheme of Alzheimer's disease, published by Jack et al. A stands for A-beta or amyloid as measured by CSF or by amyloid PET. T stands for phospho-tau in CSF or by tau PET. And N stands for neurodegeneration as measured by CSF tau or neurofilament light. Also, abnormal glucose PET or atrophy on MRI. More recently, plasma levels of amyloid, phospho-tau, and tau are being incorporated into the ATN schema. A clinical diagnosis of Alzheimer's is supported by biomarker evidence of amyloid and tau pathology, with or without evidence of neurodegeneration. Negative AD biomarkers would suggest another diagnosis, such as Lewy body dementia or frontotemporal dementia. Is there currently a place for plasma biomarkers in MCI and AD diagnosis? Plasma biomarkers are developing rapidly and are currently used in clinical research to screen which individuals would proceed to either an invasive spinal fluid analysis or an expensive PET imaging study. There is a precivity test which is available for clinical use, but this test is not yet covered by Medicare or third-party payers. This test combines the age, ApoE proteotype, and plasma A-beta levels to predict the probability of elevated amyloid in the brain. Plasma phospho-tau levels are also very promising as a biomarker and are currently under development. Should you initiate pharmacotherapy in a patient with MCI? No, there are no FDA-approved treatments for individuals with MCI. If the patient advances to dementia due to Alzheimer's, there are 4 FDA-approved drugs available, 3 cholinesterase inhibitors, and, for those with moderate to severe dementia, memantine. These drugs have no efficacy in MCI and so not worth the risk or the cost. However, many individuals with MCI seek or perhaps demand a prescription for these AD drugs. If MCI is thought to be due to depression, pharmacotherapy with FDA-approved drugs for depression may be of benefit. How should smaller clinics refer patients to receive a monoclonal antibody? A smaller clinic should complete, obviously, a history, physical examination, mini mental state examination score, blood tests, and brain MRI to arrive at a clinical diagnosis. If the diagnosis is suspected MCI or mild dementia due to Alzheimer's and the patient qualifies for Aduhelm treatment, they may then be referred to a specialty clinic for a second opinion and possible treatment. The most recent update to the criteria for Aduhelm treatment are published in Cummings et al. Journal of Prevention of Alzheimer's Disease in April of 2022. Aduhelm and other antibody treatments require extensive clinical and MRI monitoring due to significant risk of ARIA-E and ARIA-H, and a partnership is required between the referring clinician and the specialty clinic to provide essential ongoing care and management. To search for local clinical trials in your area, you can go to clinicaltrials.gov, enter a diagnosis, and state. Are there any predictions about insurance coverage for future targeted therapies in Alzheimer's disease? My prediction is that safe and effective disease-modifying treatments for MCI and AD will be FDA approved in coming years, and CMS and other third-party payers will cover the cost due to favorable risk-benefit and cost-benefit ratios. These include the costs of screening with plasma-based AD biomarkers, PET imaging or CSF analysis to confirm the diagnosis, drug treatment, and ongoing monitoring. In the far future, prevention strategies for Alzheimer's will become available to preserve cognition and function with aging. Thank you for your time today. I hope you found this information helpful.